Dr. Lou, explain to us sealants, for children. Number one, do the sealants go? Number one, are they really good and helpful and preventive? And do they go on children with their first baby teeth or with their second baby teeth? In fact, are sealants a good thing for adults? Tell us all about sealants, dental sealants.
Yeah, sealants, basically what they do, and it sounds just like the name sealants, is if a patient on their tooth anatomy has very deep anatomy, it's easy for food to get stuck in there or sticky stuff. So basically what the sealant does is kind of protects that deep anatomy, so it's harder for them to get any cavities there. As far as sealants for kids, usually we generally recommend putting them on their permanent teeth, but we've put them on baby teeth in some occasions if we feel that the patient is not brushing very well, or if like I mentioned, if their anatomy has a very deep anatomy, so it's easy for food, for any kind of sticky stuff to get there, that will make them get cavities a little easier. As far as adults, I put them on adults too, and same exact thinking. If they have no cavity there, but it's very deep anatomy, and we see that
anatomy, by deep anatomy, what do you mean here, really?
Well, basically, if it's like a ditch, it's very deep ditch in the tooth where they're biting, where they're eating on that face there. So, say they eat some candy or something, it can get stuck in that area really easy, and it's hard for them to brush out or to clean out, and so it's sitting in that area for an extended period of time, which will increase their chances of getting a cavity in that area.
So basically, have a very groovy surface, have a very rough surface, so that food can easily get stuck in one of those micro little ditches, as you call it. And that's when sealants are indicated the most. That's what you say?
Yeah, correct. That's definitely that's my point. Is where, like you said, sticky stuff or something is getting in those grooves that they can't clean, or staying there for extended period of time, so they're more susceptible to cavities.
Okay. How long does such a sealant last on an average?
It can last for a year or two. It depends on the area. Like if someone's always eating on that side, or if they put a lot of pressure on that side, the sealant will wear away a little faster. But generally, a year to 2 years, the sealant can last.
Okay. And then on an average, a person then does it again?
Yes, they can. There's a point where sometimes, even like if it's adult, sometimes we feel like their hygiene is very good and they can clean that area, then we don't put the sealant in there. But generally we put it for younger adults or kids, because they may not be brushing that area or that ditch or anatomy very well, so we're kind of giving a helping hand kind of to cover it for now until they are better at cleaning their teeth.
Okay. All right. Well, wonderful. Now we know about sealants. Thank you very much, Dr. Lou.
Thank you so much.